And we're back live again here with Dr. Price of Dental Associates. And now we're going to kind of switch up the subject a little bit, but we're going to talk about replacing one's entire mouth full of teeth with fake teeth. Coach Price, would you like to elaborate?
So many individuals are wearing dentures today. And it's a difficult thing to wear dentures. Sometimes the arches that you have, in your upper jaw and your lower jaw are compromised. There's not a lot of bone in those areas because they've been wearing dentures for a long time. So we now have the ability to actually place 4 implants, and with those 4 implants in the proper positions, support a completely permanently restored upper dentition. You hear this company called Clear Choice all the time.
Right, I see it all the time.
Advertising. This is what they do. They say teeth in a day. It's a little bit exaggeration. It's not actually teeth in a day because what you're doing is extracting the teeth, placing 4 implants, and you go home with a temporary type of appliance. So it is teeth in a day, but it's really not. Mm-hmm. But my point is, let's look at these appliances. We do these all the time. So if you look at this appliance, you'll see the 4 screws. There's 2 right in the front, and you see a porcelain
what
denture.
Is that?
That's a denture that is really not a denture. It's actually screwed into place. Let's see the next slide. So this is the side view. So there's 4 actual implants in this upper arch. All right, let's see the next view. That's the other side. So there's 2 in the front and 2 on the sides.
Well, that one screw looks like it's crooked.
Well, it's just angled because we want to put it into the area. Every implant's placed differently based on the X-ray analysis. And so we're going to put it into an area that has healthy bone.
And this is just the upper teeth, right?
Yeah, this is just the upper teeth. So now we have 4 implants placed, okay? Now let's go to the next slide. So if you look, there's 4 screw holes there, all right? We now actually screw a full porcelain appliance to those 4 implants. It cannot be removed, all right? It looks and acts like a natural dentition, and you can bite into an apple, a steak. It cannot be removed, and notice that the roof of the patient's mouth is not covered either.
Which actually eliminates the whistling that you hear when people actually
so people speak naturally,
dentures.
They look naturally.
Yeah.
And this has changed people's lives because now, instead of wearing a denture, they wear this. This is called an all-on-4, meaning you replace all the teeth on 4 implants, all right? And we do these kind of things now in a routine fashion because, again, implants are the standard of care. The success rate is close to 100%. So if we can place 4 implants in the upper jaw and in the lower jaw, we can now make permanent, non-removable type of appliances that are both cosmetically and functionally perfect.
Now, does this procedure, is it covered under dental insurance or is it all just out of pocket?
This is mostly going to be out of pocket because, remember, this is a relatively expensive procedure, okay? And not everybody can afford this, but it's the kind of thing that we can offer to somebody. Now, another type of appliance, go back to the beginning picture, if we could.
Is there like a warranty on something like this?
Well, there's warranties on everything. If something fails like this, we're going to redo it.
Right.
Okay? So if you look at those 4 implants, there's 2 in the front and 2 in the back, and somebody can't afford this type of appliance, we can make actually what's called an implant retained denture. So now the implants themselves have male attachments that stick out of the gums inside of a normal plastic acrylic denture that somebody's wearing are the female attachments, and the actual denture clicks into place. So it's got a lot of rigidity and it's got a lot of retention as well, but it's not as expensive as this type of appliance.
Now, is that a removable denture?
Yes,
or
that's a removable, but it's not removable just with the flick of your finger.
I got you.
The actual...
Like a regular denture.
No, it's not that
Right.
easy. This actually snaps into place and snaps out. So, but instead of...
And again, you can eat. I mean, you can apples, steak, everything.
Yes, you can actually
Right.
be very, very secure without adhesive for your denture.
That's
that
wild.
It's going to stay in place. So it looks like a full denture. It actually looks very natural, but instead of being permanently screwed in place, it's actually removable. And so this is the standard of care today, and this is what we do every day in our office, because before, when people were relegated to having a denture for the rest of their life, this is something as an alternative, because not that dentures aren't a great restorative means of making somebody look terrific and functional, but there's a better way now. If we can make things more rigid and more permanent and have somebody feel more secure and not have them pop out all the time, this is the way to do it.
So the industry's just totally changed.
Yeah, implants have changed the way we do and the way we treat patients every single day. I mean, it's the standard of care now is to replace a tooth with an implant.
How long have you been doing this type of care?
Well,
it's relatively new
implants,
in the industry.
in the last 10 years, the technology's changed dramatically because of the materials and because of the many, many companies that are out there now. And it's become much more affordable.
Like this Clear Choice business, they're
they're
relatively
advertising.
new.
They're advertising all around the country, but I don't want to speak negatively of them, but we do the same kind of thing every day in our offices.
Right.
Okay. In a I think in a more efficient way. So, but this is what's going on in the world of dentistry today.
Very cool. Well, that wraps it up for today, and we'll be back in about 2 weeks.
All right, great. Thanks,
All right,
guys.
thanks, guys.
This content is brought to you by Dental Associates. For more than 39 years, Dr. Stephen Price has been practicing dentistry in Northern Virginia. A member of the American Dental Association, the Northern Virginia Dental Society, and the Virginia Dental Society, Price is considered an expert in Invisalign and continues to be an award-winning innovator in the industry.